Hi, friends. Dr. Nancy Trimbley here, putting the power and knowledge of your health back in your hands. The masks are off in Indiana. Super exciting, although I would say 99% of the people out there are still wearing a mask. So that means there's a lot of fear, and we don't trust. We don't trust other humans. We don't trust our own immune system. We don't trust that we've flattened the curve. We don't trust that the symptoms, if you get infected, are getting more and more mild. With some exceptions, I understand. I want to show you some statistics from the World O Meter website that I've been using for the last year to track coronavirus cases. And I want to show you something. I want to show you Texas. And I show you Texas because Texas dropped the mask mandate a few weeks before Indiana. First, I'm going to show you, I'm going to screen share and let's see. So here we are. This is right here. This is in the United States as a whole, the number of cases, the number of deaths, the number of recovered. And I want you to look right here in this box, closed cases. You see that 98% of cases were recovered or discharged with 2% deaths. And we know that most of those deaths were in the elderly population. So 2%. So your chances of surviving COVID are 98%. Now we're going to go to under the USA. You can see here's all the states. I have the Texas COVID deaths here. And what I'm looking at is I'm looking at a projection. And of these three lines that go to the right, without masks is the universal mask. If we keep masks on in Texas, you can see it's this green line that extends to the right. Right above it, the purple line is the current projection because of the dropped mask mandate. And you can see that it nearly overlaps the green line. Now, worst case scenario is the red line. That does increase a bit. It does. And I want you to pay attention to one thing on this chart. Not only do these three lines nearly overlay each other, we don't see any spikes with the mask, or I'm sorry, without the mask. But I want you to look down here, and I'm gonna put my cursor right here at the bottom of the screen. These deaths are all deaths specific to COVID-19 patients. Well, that's worded interestingly, isn't it? It's not all COVID-19 deaths. It is all deaths specific to those patients. So if you tested positive for COVID-19 and then you got hit by a bus and died, your number would be included here. All deaths specific to COVID-19 patients. And we know this is true. I know you know people like I do, where there was an unfortunate death of somebody, and the family is irate because they know what killed the person, and it was listed as a COVID-19 cause of death. So we know this is happening. I want to take you back to our previous screen here, where we look at this 98% and 2% deaths. What we have to remember is when we look at the statistics of 2% even, this is all deaths related to COVID-19 patients. Think about that for a little bit and refer back to this site. And let's see how we do in Texas, and let's see how we do in Indiana. And then let's start trusting our immune system, and let's start to trust each other again. Let's see the fear for what it is. It is only fear. And if you have chosen not to get the reformat, not to get the vaccine, I applaud you for your strength. If you have decided to drop the mask, you walk alongside me without a mask. So you be well. Keep your immune system strong by eating well, sleeping well, keep the stress level low. See your chiropractor so your body is optimally functioning in the nerve system department. Get your exercise, and I will see you next time. As always, putting the knowledge and power of your health back in your hands. Bye for now.